Let's take a minute to talk about CPT codes. CPT is a way of classifying procedures and services that are offered by a physician. CPT is broken down into CPT-1, CPT-2, and CPT-3. CPT-3 is more experimental and future ideas, so we're not going to talk about those. CPT-1 codes, let's start there. These are typically broken down into procedures and services. So for example, E&M codes identify where a service is provided for a patient and the complexity of the service for the patient. A patient may be seen in a hospital, an office, or even at home. The E&M code will identify where this is. Also, the complexity may be different. Maybe somebody comes in for a preventative exam. Nothing's wrong, we're trying to keep them healthy. What if they come in for something simple like, I have a urinary tract infection? Or what if somebody comes in and they have 20 problems that are very complex, or a new problem that is incredibly complex? Well, the reimbursement for these is different. And these E&M codes help us to identify what was done, how complex, where it was done. And these are the mainstay of how you're going to be reimbursed, so worth learning about. The CPT also contains procedure codes. This helps us to identify specifically what procedure was done. Common procedures in my office would be things like an immunization, a blood draw, a knee injection, an EKG, maybe an ear cleaning. You can also break these down into specificity. So for example, a knee injection can be done with ultrasound or without ultrasound. The risks and benefits are different. The machines that we use are different, right? The ultrasound costs more money. So the reimbursement for an ultrasound guided knee injection is different than a standard knee injection. The E&M code paired with the CPT-1 code for the procedures that were done equal your reimbursement for that office visit. What about these CPT-2 codes? CPT-2 codes report how well a disease is managed. So for example, I may say my patient has high blood pressure, but that doesn't mean they're controlled. It doesn't mean they're uncontrolled. The CPT-2 code is built into most electronic medical records and draws data such as lab data or vitals like blood pressure and reports it as being within the range or out of range. This helps us understand the quality of care that's being given to the patient. For example, if we have a provider that has CPT-2 codes where nothing is controlled, the A1C on a diabetic is too high, the blood pressure is not controlled, that doctor seemingly isn't doing a good job. This is reported back to the insurance company, and oftentimes reimbursement can be dependent on how well you take care of your patient. So the more CPT-2 codes that are at goal, the better reimbursement you get. That's a way of improving the value for yourself and for your patient because we're doing a better job taking care of them. CPT-2 codes allow us to do this. They're optional, they are not required, but they can be really helpful in the management of chronic diseases.